I'll just give you a brief about the World Skills Competition, India Skills Competition. It will be very useful for you. I hope you can see my screen.
Yes, sir. It's visible.
Thank you. So, as you know about that, the World Skills Competition, when we see that, so in this presentation, we will discuss just about that, the what is World Skills Competition, how this World Skills Competition be conducted, where and who can participate into that World Skills Competition. So let's see, and let's start with that. What is the World Skills Competition? So, as you all aware about that, the Olympics for the various games, right? It is the similar as like the Olympics. It is a skills Olympics. We also called it. And for the skills competition, it demonstrates a different competency in different job role. And there are the 52 job roles in which the people come from the different sectors and different industries, and they demonstrate their skills into the different 52 roles. So please recoil if you know that the Olympic Games and the for the athletes for the various games, the Olympic, that is the same. So you know during that the games Olympics, what happened, the various games the people play, the competitors play, the participants play, and then they get that the medals. So before they go into that the World Olympics, they appear it into that their local, their state level, their regional level, and the national level, and the one person who represent their country into the World Olympics in the particular sports. The similar way in that is in that game, the similar way in the skills competition, there are the different skills which is mentioned here. The 52 skills are there, where the various participants they participate into that. They appear into those different job roles and demonstrate that skills. So what they do into that, they execute the specific task, they complete their modules in a given time framework, as similar as like in the sports. They have to run, they have to participate in athlete, they have to participate in badminton, whatever the different their sports. In a similar way in the skills, they have to demonstrate the different skills. So one of the skill is the health and social care, which is more focused on the delivery of healthcare. And we will see into the later in those in this presentation that what are those skills they have to perform for the India skills competition, and whoever wins into the India skills competition, that person represent India into the world skills competition. So I just show you that the one glimpse of this video, that how the this world skills competition helps and what is this all about. So you can have a sense this how this world skills competition.
COVID-19 World Skill. Polska! Portugalia! Saudowskaya! Armenia! Singapore! Singapore! Южная Африканская Республика. South Africa. España. Grecia. Sweden. Italia. Китайский Тайпей. Chinese Taipei.
One to for our support of our sponsors and partnership, которая
Дамы и господа, подъем флага World Skills. Ladies and gentlemen, the World Skills flag will now be raised.
So I hope that you see that this is how grand this is, right? And so now you can have a sense that the how grand this platform is, how big is this platform is. This is similar as like the sports Olympics, and all over the world, the people come here, they participate here, and then they fight for the medals. So as I told you that to go into the World Skills International, to World Skills competition, the first you have to clear that the India Skills competition. The India Skills competition is the largest national level skills competition. It held every alternate year. And first in India, it has started in July 2016, and by the Honorable President of India at that time. And India Skills is the country's biggest skills competition. And I'm telling you, this is the biggest and the largest platform to show your skills, the competency, your behavioral skills, your communication skills, your clinical skills for the healthcare professionals. And India Skills competition is held every 2 years with the support of the state government, with the industry, and the respective healthcare sector skill council is the ultimately host for that, who is involved into that to how to conduct into the country in collaboration with the ministries and the NSDC. What is the vision and mission for this India Skills competition, or you can say for the World Skills competition? This is the platform where the various professionals, they display their workplace skills and with the perfection. And we are very proud to say that the many of the Indian nurses and the healthcare professionals, they migrate from India and work into the different countries because they are very good into their skills and competency. And this is the platform where we have to show to the world that, see, this is the platform where we can show to the world that we are really having that the best skills and competency. Specifically, I'm talking for into that the health and social care. This platform also helped the Indian youth to attain the world-class standard and competency. We have to prepare ourselves through this platform that what exactly that as per the global standards, we have to meet our standards, protocol, competency, and skills. So India's performance at the World Skills since 2011, you see the India participated in World Skills competition in few skills, not in all 52 skills. And from 2011, and see that from gradually how we increase those skills and also the number of the medals we are getting into the various years. And also, so the different participants they are getting. So last two times, India participated in health and social care in 2 times. Only in 2019, in which was happened in Russia, and India won the gold medal of, India won the Medallion of Excellence. And Taslim was the competitor who represented India. And last year in France, again, the India won the Medallion of Excellence, and the competitor was Saraswati PV, and she got that the Medallion of Excellence. And this is the, as I'm saying, only last 2 times India is participating in health and social care, and every time India won that the Medal of Excellence in health and social care. You know very well about me, so I'm not talking about myself. Why this is the this competition is most important for us because it benchmarking the skills level. You know, when you come on this platform, you have to prepare yourself as per the global standards. So it is the benchmark for your skills and competency that you are preparing yourself, you are preparing your competitor, you are preparing your participant for the global standards, because they have to participate, they have to prepare themselves to participate among with the all these different national participants. It's also improvement in the training and assessment methodologies. When you prepare somebody, then your training will be more tough, stressful. Your assessment will be more tight and hard, because you have to prepare somebody as per that the global standards. It's identification of talent of industry and also employer from where you are preparing this candidate. This college also get the benefit because you maintain your standards into that high. Creating the role models when you prepare the students, even for the state level, even for the regional level, even for the national level. When you prepare your students, you are preparing your students as per the global standards, and you are preparing for the world skills competition. So think for that, when you prepare somebody, then how it is important and why this is important, because you are preparing the role models in your community. Okay. When this happens, this competition happens internationally in every 2 years. Upcoming one is September 2024. National, a year before the World Skills International Competition. So this year, now the registrations are open for the India Skills. You have to apply right now for that. 30th November is the last date for the applications. And then the Ministry of Skills Development, NSDC, and Healthcare Sector Skill Council, they will conduct at the state, regional, and national according to the timeline. So this time the World Skills Competition is going to be conducted in France, in Lyon, 2024, where all these participants will come there. In health, now we talk about in health and social care specifically. This is all just I spoke about the overall India skills and the World Skills Competition, but now I'm particularly talking about the health and social care domain. In that sector, what happened? Who can participate? The first point, who can participate into this health and social care domain? Any healthcare professional. Any healthcare professional, be doctor, nurses, paramedics, anybody can apply for that. Only that the condition is that that person's age, it should be less than 22 years. Okay. How this competition happens for the health and social care? This competition is for 4-day competition. I'm talking about that the national and the World Skills Competition. What happens into that? It's a 4-day competition. You have to, a candidate or the participant, competitor, whatever the word you want to use, has to perform that the nursing skills. It's a nursing skills. Into that they can get the patient. For that patient, they might have that the one scenario. In that scenario, there's a different task to be given to them, and those tasks into the limited time period they have to perform. And all these skills are the hands-on skills. So they have to take care of the patient as per that the international standards. Also, the communication skills are very, very important. How the participant has to talk to the patient. It should be in English language. How they have to speak to the patient, how they have to talk to the patient relatives according to the different scenario. The communication skills are also be judged. One is skills also they check the poster presentation. Poster presentation, they give on the spot that the one topic to prepare a poster, which should be like a health education poster. So it might be related to the disease, it might be related to any treatment, it might be related to the nutritional health, any topic which the candidate has to prepare the poster. Report writing is the one of the tasks in which he or she get the marks. Report writing, in which whatever the care you do for the patient, whatever the task you have performed, on the basis of that you have to prepare a report in certain time period, in a specific time period. And then your report should include that according to the timeline, what the patient needs, how those needs you have fulfilled, what are the outcomes of that, whatever the interventions you have done for the patient. So that is the report writing. Also, before going to the patient, you will get your assignment. Your assignment, in the sense, you will you will be assigned for a patient, and that for that case scenario, you have to prepare a care plan. According to the care plan, whatever you write into the care plan, your objectives, your planning, your observations, whatever you write it into that, that will be submitted to the jury. Jury will see your care plan, and according to the care plan, you have to perform your skills on the patient. So that in that way, this competition occurs. So nursing skills, hands-on practice, communication skills is very, very important, because many of the time the patients are from the various countries. They are the standardized patient, right? We treat them as per the Indian standards. So that also we have to see that how we have to communicate. Poster presentation is important. Report writing, as I said, that what you need to write in the report, and the care planning, which is related to your assigned patient. So what is in the project and what are these case scenarios? So these the four project and the four tasks we say that every candidate has to perform. The one case related to the hospital care, one is related to the home care, one for the residential care, and one for day care. So in all 4 days, every day one project the competitor has to complete. Hospital care means the patient is in the hospital. You have to perform that the hands-on skills and the communication skill on the hospitalized patient, where you will get a scenario when the patient is inside the hospital, and as a caretaker, you will come to the patient and what are the different care you have to give to the patient according to the case scenario. Similar way for home care, where the patient is at the home, where the home caretaker or the caregiver is coming there, you might have that the one case scenario. That case scenario might be related to the psychiatric patient, also might be related to the any medical disease, might be patient related to any surgical post-surgical case. So any of the case, you can get it. And in all 4 projects, you will be assessed for the communication skills and the hands-on skills, right? Poster making, reflective report, which is the report writing, I already told you, and the care plan. Reflective report, what did you learn from that task, right? What was your experience? Whatever you have done on the patient, that you have to explain into your writing report, that, okay, the task I have done, this was the outcome. If I could do in this way, this would be much better. If it can be done in this way, this must be better. Or you can say, okay, that all these things, whatever I have done, I met my goals and achieved that the goal for the better patient care. How the setting and the environment, where you will get that this in the World Skills Competition, it is not an easy place to be there. It is a very stressful place, where you can imagine that every competitor is sitting into that place. You will see that all the stations have set up. The different standardized patients are there. Standardized patients means the patients who are there, who act as like a patient, they call these standardized patient. However, you cannot do any intervention on them, but they are mostly the actors who act as like a patients. So they will be briefed before the case, before the presentation, that how they have to behave, in which case they have to react, how they have to react. So they are called as the standardized patient. There won't be any mannequin, there won't be any dummy. In all cases, you will see the real patients. Real patient in the sense is standardized patient who act as like a real patient. Even if they are the surgical patients with the surgical wound, that the moulage wound will be pasted on them or created on their body. Even if they are, if you will get a patient with the trauma, if you will get a patient with any of the injury, everything will be moulaged on their body. So you feel like, okay, this is the real patient. Most of the patient are the English speaking patients. So it will be good, because if you can understand their accents, and also they can understand yours. It has simulated daycare, simulated hospital and residential care. As you can see in the photo, everything is there, right? So if the hospital required that they sink to hand wash procedure, if the person is in the home care setting, you see in one of the photo, the home care setting has set up with all these photographs, wall clock is there, the home bed is there. So everything is related to. So then you can replicate, okay, this is the same scenario that you are in the home, you are in the residential care, or in the hospital. So every day, the 2 tasks to be performed by the competitor. So if suppose the 2 tasks by the competitor means, if suppose the hospital care, you might get the 1 hospital care for the communication skills, and the same day you will get the another is for residential care for hands-on practice. So every day the competitor has to perform that the 2 tasks. Marking scheme, it is based on the technical description. As I said, the technical description means the hands-on practice. Work organization, that how you prioritize your task. Okay, that is very, very important because you have limited time to perform. Maximum, they have 25 minutes to perform that the 1 task. Out of 25 minutes, 5 minutes are for familiarization. And in next 20 minutes, you have to complete your all the tasks. So work organization, when you prepare your care plan, in that you have to mention in which flow you have to complete your task, and according to that you have to complete. So the marks are also there, because if you are not able to perform all, then rest of all these tasks which you're supposed to perform, you will get the 0 into that. Communication and interpersonal skills, which I'm keep talking for that. That's the most important part, because the most of the marks are there, because for everything you have to communicate with the patient. And as I said, they are the standardized patient. They are not dummies. They are not mannequins. So they speak well. They'll give the answers for your queries. They do whatever you want to have them to do. Problem solving, innovation, and creativity. In that what happens in some of the cases, the jury asks you, okay, this is the case scenario, and during that time, this on a sudden this happened. What do you do in that case? Okay, so suppose when you are asking to the patient is not responding, patient is having some psychiatric problem, patient is getting aggressive. So what do you do in that situation? So immediately you should have some critical thinking, and then you have to have a problem solving creativity, that how do you manage with the patient. Either you make the patient more aggressive, or you settle the patient properly. Assessing needs and planning the client care, that is the one of the point for marking. How do you assess the client needs? Okay, when you enter into the patient room, how do you assess that, okay, the patient is in this position, whether I should give that the proper position first, or whether I should just start my task first. You have to plan accordingly. Managing and delivering the client care, whatever the client needs, according to their whatever the plan you have prepared, you have to deliver the care accordingly. And evaluating the client care, that is your reflective report, that whatever the care you have given to the patient, that you have to put it into your reflective report, that I have done this thing for the patient and what supposed to be done. So this is all your points for the marking. And it's a note is that the assessment checklist have many components under one heading. So if suppose that under the communication with the patient, if suppose this is the one heading, communication with the patient, under that, or the heading might be greeting the patient. Under that, there might be a lot of components. Time with the patient, introduce yourself to the patient, introduce yourself with the full name to the patient, introduce, did you ask the patient name? Did you ask the full name of the patient, or just half name to the patient? There the small components are there. So if you miss any one component, then you'll get 0 for the whole, right? So this is the very, very tough marking scheme, because it's as per the global standards. You know that it is the world skills. So they have to do very carefully, the juries, they have to do very carefully that how you do, how you perform. They mark your all these skills and competency on the basis of that, the various components which are given into their checklist. So these are the tentative timelines. I think that we are going according to that. But anyway, according to that, the different years, whatever the different protocols for the ministry, we are right now in the December month, and we'll start with our state and the national competitions to select anybody that whoever represent India for the World Skills Competition, which to be conducted in September 24. So so again, I'm saying 30th November is the last day for your registration. Please register yourself. Please prepare yourself at least for the state competitions, regional, and let's see if you can come up to the national, and from the national, if you can represent your country. So different resources, you can go through this website of worldskillsindia.co.in. You can get a lot of information about the India skills, about the world skills, and many of the details you can get it from there. Many old videos are there which can give you a sense. You can watch into the YouTubes also. Many world skills videos, India skills videos are there, so you can have a sense that what kind of this platform and how we can prepare ourselves for that. And you can collect the more informations from worldskillsindia.co.in, and a lot of information you can get, all the timelines you can get it from here. And I look forward to see you here into the World Skills Competition and India Skills Competition. And this year our goal is to get the gold in health and social care, because we are really proud on that the India prepares the most of the best healthcare professionals, and we have to show to the world through this platform, yes, that really we are the best, and I should say the best into all health and social care, and our competencies and skills are best. So thank you so much. If you have any queries, you can ask, or you can put it down in the message box and we can reply to you.
Thank you so much, sir, for the interactive session. And I think everyone knows about that what is world scale and how we have to apply for that, and the rules and regulation and different activities which is covered in a world scale, especially for the part of health and social care. Because this is a part, I believe, because I'm also a healthcare professional. Many of the person didn't know about that these kind of facilities is also available with us in India, and our government is also promoting these kind of things, and we have such experts like you who can train the candidates, and we can make India as a competitive worldwide. So thank you so much for the brief description. And now it's a question answer round. If any students or any candidates have any doubt, any question, you can ask. You can raise your hand, we'll unmute you and you can ask your question. I believe that every doubt is clear for everyone. So just for a reference, if anyone wants to have a view of all the details which is shared in today's webinar, you can go to HSSC YouTube channel. This webinar is live there. Yes, Miss Vinita, you wanted to say something?
Yeah, I have a doubt.
Sure.
Like, if you have some like scenarios where like how the scenarios will be given for the student to compete during this competition, if you can share with us or you can tell us with an examples, it will be useful for our students to prepare for it. No?
So you're reverting it, or we have? Hello, am I audible, sir?
Hello. Yes, ma'am, you're audible.
Jadip, sir?
Yeah, so I think that if Priyanka is there, or
Yes, sir, I'm here only.
so
So,
Priyanka,
ma'am, you can, yeah. So, sir,
yes, ma'am, we give that the some sample scenarios
yes,
for these
yes, we
students to
have a
prepare.
sample test project on our HSSC website. So, ma'am, you can go to our website and can have a look at the sample test project in which we have given the scenario, the cases on which the candidate can be trained and can do practice. So, if you are looking for the scenarios for the practice, you can have a look at our website. You will get it there.
Okay. Do you have some
Yeah.
videos also? Ma'am?
Video though I don't have, ma'am, actually. But we
How
do
will the
have the test
setup be?
project.
Yeah, how will the setup be? Like,
Let me just give you an answer for that. I think that you
yeah.
can find out some videos on YouTube, but very rare, because it is restricted during the World Skills Competition that they can video for the whole session. So the people can take the photographs during the session, but they cannot videotape for the whole session for any competitor. It is restricted. So therefore, we do not have that's the videos.
Okay, sir. Thank you so much.
Any other candidates want to ask something, or will end this meeting? Okay, so as I briefed you earlier that for the today's webinar session, the session is live on the YouTube channel of Healthcare Sector Skill Council. So if you have any doubt and you wanted to see the details again, you can have the session and you can check all the details in the Healthcare Sector Skill Council YouTube channel. And we have a number, I think link is shared with all the candidates already. And we have a helpline number also, and if you want to connect with them or you have any doubts, you can contact the concerned person. Thank you all. Thank you again, sir, for this wonderful section. Thank you all the participants to join.
Thank you so
Thank
much.
you.
Thanks.
Thank you, sir. Thank you, everyone.